Good morning, good afternoon, good evening, everyone. Welcome to our 32nd webinar. I'm Neeti Daftari here on behalf of the Circle of Cleft Professionals. Today, we will be hearing about the use of art in promoting psychosocial health and well-being. We will be having simultaneous interpretation in Spanish for the entire duration of this webinar, for which we have Ben and Eva joining us from Chile. At the bottom of your screen, you will see an interpretation button. If you would like to hear the rest of this webinar in Spanish, please click on that button and select Spanish. If your bandwidth allows, please keep your video on. Feel free to use chat to introduce yourself to the group and tell us where you're from. Please keep yourself muted when not addressing the group. At any point during the presentation or discussion, you can share your questions and comments on chat or use the reactions button at the bottom of your screen. Once the panel presentation is done, we'll open for discussion where you can post your questions either via. Our agenda for today, we will begin this hour-long webinar with a quick COCP update. Post that, this will be followed by a panel presentation for the first half hour, for which we have Isabelle Wachsmuth from the WHO, who is joining us from Switzerland. She will be leading this webinar presentation along with three Smile Train leaders, Dianne, Andrea, and Camila. Once that is done, we'll open for questions, discussion, and closing for the remaining half hour. We have three core objectives at the COCP. Our aim is to facilitate collaboration and networking amongst cleft professionals to communicate the learning and impact that's happening within cleft care and to support the growth of local teams in implementing comprehensive care. Our membership is constantly growing. Our largest membership group is cleft surgeons at 185, followed closely by speech therapists at 149. These two groups by itself make up more than 50% of the COCP. We have far fewer psychologists and social workers working within cleft care. And at less than 3% of COCP membership, this is a group that we hope to see grow. And today's topic will hopefully help point out to why this group, the psychosocial professionals, are so important to completing cleft care. As you can see here, we have our 650 plus members spread across the globe with a recent surge in membership from countries in Africa. A shout out to these 11 international charity organizations who have come together to make the COCP and all of its activities possible. Over to you, Hugh, to introduce our topic for today.
Thank you, Neeti. Again, my name is Hugh Brewster. I'm in Toronto, Canada, and delighted to be here on behalf of the Circle of Cleft Professionals. We were talking a little bit as we got started with our technological check a little bit earlier this morning, and really, this idea of what is comprehensive cleft care and how it can be beyond what some people's conception of this direct medical attention and how it all gets tied together a little bit with how we care for patients and families. So I'm delighted this morning or this afternoon or this evening to introduce Isabelle Wachsmuth from Switzerland, as Neeti mentioned off the top, and I think we'll hear through their presentation a quick introduction to Dianne, Andrea, and Camilla, who are leaders within the Smile Train movement, about what they've been working on really in connection to these Sustainable Development Goals, or the SDGs. And I think this idea of that holistic care that we're all seeking to see really implanted throughout LMIC contexts can be explored through this idea of art. And so without further ado, I'll pass it over. I think Grace in New York from Smile Train will be leading through a PowerPoint, and Dianne will be, Isabelle will be facilitating the beginning of our webinar. As you have questions or comments along the way, please feel free to type them into the chat. And we will spend a good half an hour really thinking about how this might apply to our own context or asking some more questions about this kind of initiative and how it could be implemented through our own teams. So thank you. Grace, take it away.
Thank you, Hugh, and thank you so much, Neeti, for that amazing introduction. Just a brief introduction. Hi, everyone. My name is Grace Peters, and as he mentioned, I work at Smile Train. And just we'll be presenting on advancing global health through art with our partnership at Smile Train with the WHO. And just to make one comment before I move over to introductions, that this Art Impact for Health movement is really an incredible initiative which focuses on supporting children with cleft lip and palate and improving their self-confidence and resilience, and at the same time bringing together community around this amazing effort, which you'll hear today from my colleagues. And so we can go around, I guess, and do a brief introduction before getting into the panel. So Isabelle, we can start off with you.
Thank you so much, Grace. And it's such a pleasure to be with all of you today. And what I will share with you, it is really the overall of this initiative, you know, and with our colleague, we will go more in depth, you know, specifically about how it has been implemented at country level. And it is an extraordinary story because, you know, when you want to change the world, it is the start, it is always through what I will call an incubation. And I have been able to do that with my organization, World Health Organization. And the idea, it was really to test, you know, how the art can impact health, but as well, now at UN as well, Sustainable Development Goals. And why we have decided to do that, to experiment that, it is because, you know, we consider it's not enough to communicate specifically with such a large stakeholders, you know, in the world, and specifically now because we are all interconnected, we can see, you know, with this big societal challenge we face, how everything is interconnected. And it's for this reason, sometimes when you communicate only with data, you know, a number, it's not enough. So it was really to consider, you know, how artists specifically can be on board as well to deliver incredible societal challenge. And it's for that we have developed this initiative at Impact for Health and Sustainable Development Goals. And it was born from the deep desire to work for a better world by federating local initiative, and we will see that with so many examples, specifically from Latin American countries after my talk, to bring well-being to people, the planet and ecosystems together, to really provide an holistic perspective of well-being and health. And a thought that may seem utopian, but that it is possible. And I would like to thank all the collective in the world, and specifically all the artists, the scientists, the different, you know, association, you know, non-profit organization, foundation, as well leader of initiative over the world, you know, and to have this desire, all united with transparency, fairness, to work for the good, common good. And the beauty, it is art to establish more meaningful and inclusive dialogue and communication, specifically with all the partners we have, you know, in UN, focus on the implementation of Sustainable Development Goals, you know, and like that, to be able to really engage in very sustainable ways the beneficiaries, but all the beneficiaries, you know, specifically the most marginalized and isolate, you know, communities in the world, and to contribute really in action, in practice to the global health, you know, movement. And for that, you know, what is our vision is very simple. We consider art is universal language. It's a way to interconnect all the countries and to learn from each other and to co-create, in fact, with each other. Art has no borders and promote diversity in unity. It responds to our needs to share, inspire, and transform. It transcends our perception and sense to reveal our infinite potential and inner well-being. It is really what we try to achieve, of course, with very concrete practices and activities, and that will be very well demonstrated by this initiative, specifically at the national level, at country level. And as you have seen, we are working at 2 levels, at national level, regional, 3 levels, national, regional, and as well international level. And the idea it is really to identify, for example, some local partner, including some local artists, we can work with. And after, when we develop this art creative workshop, and we will explain later more in details what it is and why we are doing that. It is really to showcase, at the global community level, specifically, of course, in healthcare, but not just in healthcare, but as well the community in charge to implement, again, sustainable development goals, to demonstrate how art can make the difference, and how the artist can be extraordinary contributor, for social change. And our mission is very clear in this sense. It's really the first elements. It's really how we can contribute in more meaningful, I will say, way. And for that, it is to really design this artistic expression and co-creation, specifically to have health for all and inclusive well-being approach. And it is really to encouraging healthy lifestyle and contributing to mental and physical well-being, the both together. And we will see why it's so important for all the individual. And why it is critical, because that will be as well profitable for their families, their community, and their country. And it is really to create for us a worldwide creative design movement, and to inspire each other, without any, restrictive, way of working, but really to work in a very organic way. And the other aspect, it is really to accelerating understanding of universal health coverage and sustainable development goals, to generate impact. Again, what I have mentioned, country, regional, and global level. And as well to highlight the power of creativity through this multidisciplinary approach, because with this initiative, we are able to bring together artists, patient, community, health professionals, policymakers, researchers, entrepreneurs, and to have this multi-sectorial networking, what is so needed in this world today. And it's very important for us, as I have mentioned, to complement and translate scientific guideline data or any quantitative data, because, we need as well to express, our, I will say, sense of humanity in different way, and sometimes scientific is good, but need to be complemented with specifically culture and art. And for us, we consider that extremely valuable and a way to move forward together. So it is a better as well way to improve understanding of fact and drawings what it is for us very key, the connection over the world. And just to finish, today in terms of impact, we have been able, to organize several international art exhibits based on country art exhibit and art creative workshop, and specifically we will see that in Latin America, and to communicate through this international exhibit about the importance to really contribute all together on the implementation of sustainable development goals. And from this impact, what have been highlighted, it is in terms of the impact of art creative workshop, the main skills have been developed, and we will see that more in details after. It's a sense of belonging, self-confidence, fluent and inspirational communication with others, and social inclusion and cohesion. Look, we think it's a really very impressive approach to specifically to reach the most vulnerable people in the world, and we in WHO, we consider we cannot just talk about don't leave people alone. You need really to act on that and to have very integrative way to do. And art is really the way we consider it is the way forward. Thank you so much for your attention, and I will give the floor to my colleague to tell you more details about what we have done together. Thank you.
Thank you, Isabelle. My name is Camilla Osorio. I'm a psychologist from Medellin, Colombia, and I have been working with cleft patients and families for a little over 2 years now with Smile Train and Clínica Noel. And my job consists of accompanying families and parents and patients throughout their cleft journey in all the different stages of treatment and providing psychosocial care throughout their different needs. It's common for us to not only find challenges within the patients, but also parents. When they find out they're gonna have a baby with cleft, they have their own sets of challenges, and our part of our intervention is helping parents cope with the news so they can offer the best part of themselves. We also find challenges with our patients related to low self-esteem and low confidence due to having a hard time expressing themselves, like their thoughts and feelings, as well as having troubles with their social skills, thinking they're being judged by their condition. All of this, if not treated or attended to, can have a negative impact on their adult life. That's why giving a chance to involve art into psychosocial activities seemed like a perfect opportunity. Art provides multiple advantages that are especially important to our cleft patients. It helps them develop patience, perseverance, encourages them to explore their creativity. It becomes a positive alternative to accompany difficult behaviors such as aggressiveness, impulse control, among other things. It also helps their social skills since the activity becomes a teamwork as well. It allows children to express themselves and articulate their feelings that would otherwise be internalized for reasons such as fear or confusions about their situations. While working at Clínica Noel in Medellin, Colombia, a Smile Train for many years now, I was asked to participate in the first Art Impact for Health in Peru. I was very excited about this opportunity since art is such a great way to reach patients and give them a different opportunity to express themselves, and it could provide important tools for our patients and their families. After the first event in Peru, we decided that this initiative was so important that we organized an Art Impact for Health in Colombia with a local art foundation, Mandalas for the Soul, giving out our patients the opportunity to explore their art abilities, to find a new passion with art, and find that as an outlet for all the difficulties mentioned before. Another important aspect to include when it comes to art, there are no limits, there are no right or wrong ways to express yourself. There are so many different tools, strategies, methods, and any other form of doing art, and that's why it's at such a great value to any intervention. So for example, here in Colombia, we focus on drawing mandalas with a mindfulness approach, a type of art that lets children express themselves, also improvements in self-control, attention, lower stress and anxiety, resilience, and better academic performance. Adding to the benefits of involving art, it also provides care for our patients and family. It's important to understand that when it comes for these events, it makes them so successful because every new initiative for Art for Health is brought up. It takes into account the country's culture. Taking that into consideration, it also helps us understand their beliefs and practices, so it encourages patients, medical workers, and artists to be more eager to work with us. It also helps raise awareness and sensitivity to their backgrounds. Working with locals lets us strengthen our bonds as a community. People that have never heard of Cleft Lip or Palate, Smile Train, or any other partners will have the opportunity to learn more and be conscious of our work, and therefore more open to working together again and helping us open new doors and reach more people. Also allowing us to reach different media outlets to promote comprehensive care on cleft patients. With this Art Impact for Health, it also gave us the opportunity to strengthen ties with our families, create new networks, and most importantly, our patients and families can form ties with other families. It also helps with comprehensive care the Smile Train offers, since patients are encouraged to work and continue with their treatment, generating a sense of belonging. With that being said, it's important to be able to measure our impact. And for that, we use a survey that allows us to measure different aspects of the activities from different perspectives, such as patients, parents, professionals, or any volunteer that are involved with these activities, and how these activities have an impact on their life. So I think Diane's going to tell us a little bit more about what went on in Peru, which was the first Art Impact for Health.
Let me see. Hello to Hi, everyone. Thank you very much for your attention. It's an honor to be here. Thank you, Hugh. Thank you, Niti. Isabelle, a pleasure to see you. My name is Dianne Erquiaga, and I am the program director for Small Train South America. For me, this was an incredible opportunity when I was asked to put together this Art Impact for Health workshop in Peru. It was a great opportunity, a learning opportunity for me. First, I met Isabelle, which we really have a great relationship since then. And something that helped me very much was to attend Morocco, a workshop that she was going to have in Morocco. So it gave me an idea of what we needed to do in Peru. Art Impact for Health is an initiative from the World Health Organization that her founder and creator is Isabelle, that use art within the medical field to build resilient individuals, communities, and health systems. For Small Train, this is a great initiative to incorporate art to the healing power of art and to achieve the SDGs. As for my experience in Peru, this event was an opportunity to explore how art is a powerful tool to support the psychosocial health of children and adolescents. This is an initiative that unites a community of artists, patients, families, providers, policymakers, and advocates. Watching patients and providers express themselves through art, it really was an incredible and moving experience and very emotional as well. During the event, they were no longer patients or families or providers. They were all artists united in creating and healing. So this experience for me helped support the rehabilitation and long-term health of the children. When I was asked to put this together, so aspects that some of you that eventually are looking forward to have an event like this, my advice will be things that you will need to consider to having an event like this will be to first find a person that could help you. The right, for me, was engaging local artists. So one of my partners that I will tell you a little bit about it later on, help us with this, and he's a doctor and a very well-known artist as well. So this was something very important that you guys can engage local artists within the with global potential. That was something important. It's something that it helped me a lot into making this event successful. Also very important is to ensure that you have an inviting space and caring professionals available to support your participants, because one person cannot do all of this. So it's a team effort, definitely. And to plan ahead to measure impact and spread awareness. So that's something on the first one we did, at least in the, with Isabelle, that was in Peru. We consider how is that we're going to measure this. So that's how Camila got involved. In Small Train, we have a South America medical advisory team. So we engage our psychologists, Dr. Marta Jaramillo, and Camila works with Dr. Jaramillo. So we help put together a survey with the help of Pam Sharon in the US as well. So that was the tool that we used to measure the impact. So for example, in Peru, I was able to learn also through all of this experience that in ancient culture, pre-Hispanic culture, moche, that grew between 100 and 700 years before Christ, they used to do ceramics, and we call it huacos, featuring people with cleft, and they were considered special people. This culture grew in northern Peru, in the city now called Trujillo. And precisely the doctor and partner that I use, Dr. Antonio Segarra, he's from that city. So he started also, he was very motivated and started to investigate further. And he learned how in ancient Moche culture, these people were considered very special in their community. So I guess this also helped me motivate him to do more research and to really get engaged in this activity. So we find an architect who's also an artist who helped us put together these beautiful masks that had cleft. So it was on the first day of the activity, we had a special get together with artists, families, healthcare professionals, policymakers. So this whole community that got together for the kickoff of this event. And on the second day of the activity, we put together a creative art workshop at Clínica Segarra, where patients had the opportunity to express their insights and feelings about the surgeries they had already received or they were going to receive. On this workshop, which included, we also included the patient's families and, as I said, health professionals. They helped humanize the hospital experience and facilitated a cooperation between the health, education, and cultural sectors. We also engaged, as I mentioned before, local artists and national policymakers that help raise awareness of both cleft lip and palate and the urgent need of strengthening health systems to advance health for all. So on the personal level, this was a great experience for me and for the professionals that help us put together this event. And then we later, months later, we had an event in which Camila showed a little in the slide before how we did it with, that was during the pandemic, so it was virtual. So Isabelle, as always, so kind, we connected via Zoom, and she was there painting in her house while the children were doing these beautiful mandalas. And again, it was a great opportunity for these families and children in Medellin to have this beautiful activity that again reunited communities, policymakers, professionals. And as I said, we all get engaged and we become artists at that moment. So it's a powerful healing tool from my perspective that I wish we would continue to do more in other regions with Smile Train in the WHO organization. So thank you very much for your attention.
Thank you. I am Andrea Naya. I'm the Senior Program Manager for Smile Train Mexico, Central America, and the Caribbean. And I will share a little bit of the experience we had in Mexico after Peru. I think that, as Camila mentioned before, one of the most significant aspects of this project is its cultural sensitivity and the adaptability for every cultural environment where it takes place. It's far from a globalized or a neo-colonialist model or a cultural appropriation approach. This event allows us to let the community tailor the project to their needs, to their views and their interests. And that is how Art Impact for Health in Mexico was able to be merged with one of Mexico's most important, most engaging and representative cultural celebrations. It's Dia de Muertos, or Day of the Dead. This is a day where we celebrate the joy of life by acknowledging death as part of the human experience. So we Mexicans for Dia de Muertos have the tradition to place offerings to our deceased ancestors to receive the spirits that night. And they will be returning from their eternal slumber to become a vibrant part of the community and party with us for one night. So we honor them with laughter and joy, and we eat sugar skulls with our names on them, like in a way to add sweetness to our concept of death. So in that context, we were able to bring together 10 amazing Mexican visual artists, 11 cleft patients from 9 to 18 years old, and their families, and also the medical professionals of 3 of our partner centers in Mexico. The artist intervened 10 fiberglass skulls that also incorporated a cleft, as well as the masks in Peru. And they used different artistic techniques over the course of 1 week. And at the beginning, they didn't even know what cleft was. And it was thanks to this project that they were able to understand it even to an anatomic level on the process of creating the cleft skulls cast. Then on the day of the event, they delivered an art workshop for the patients. And after the workshop, the patients were also able to intervene their own fiberboard cleft skulls. We finished with a beautiful art exhibit where both the work of the patients and the artists were displayed together. We had a beautiful opening ceremony with remarks by some of our medical professionals and Smile Train representatives and Isabelle from the WHO. And I think this event not only gave our patients and other participants the opportunity to experience art, like this allowing them to cultivate this exceptional sensitivity that only the artistic experience provides. But they also, I mean, this event also intertwined or weaved a part of a social fabric, bringing together a community where individuals that otherwise might have never met exchange their own experiences and identify themselves in the others, understanding the other's point of view, tearing down barriers of prejudice and stigma, and creating a support network and a safe space. So using Peru's event as an example, we conducted surveys before and after the event to assess the motivations of the participants, the impact that the event had on them. And according to these surveys, most of the attendees stated that participating in the activity increased their self-image and self-esteem, generated a sense of belonging to the community and their treatment center, inspired them to continue building and finding different artistic skills that they might not have identified before, generated community values and empathy towards others, and allowed them to obtain a global vision of cleft. And one of the best examples of these is little Diana. You can see her picture in the upper right corner with that beautiful smile. Diana is an 8-year-old cleft affected girl. She had a rough start in this world with many difficult situations happening in her household. She grew up with her grandma and her father, but they struggled to find proper cleft care at the beginning. So she had numerous complications after her first surgeries, including BPD. Fortunately, she arrived at one of our partner centers, Contigo Sonreímos, in 2019, and she started receiving speech services and psychological support. And her psychologist, Dr. Leticia Munguia, reported that she was very timid and quiet at school. She struggled to make friends to open up. We would have never imagined that this was how Diana would be typically described, because the day of the event, she was the happiest child in the room. She was dancing around, playing and chatting with other children, showing us her dance moves. She was even playing with the photographers and using the microphone like she was filming everybody. So Dr. Munguia reported that this event really helped her find her safe space. She really flourished there. So since then, this partner center has been arranging arts and crafts workshops for all their patients, and Diana has enjoyed every single session of it. Her father had never seen her so happy and outgoing, and as he sees her today, and he's extremely grateful for that. And this is only one example of the impact this event can have in our cleft patients. But the power of this event didn't end there. The fact that we can bring this event to the public eye helps us raise awareness around cleft and our cleft patients' needs, and spread the word to the world on how to contribute to our goal. So ultimately expanding to foster a global community, a vast support network. And this is why the artwork created on the cleft skulls for this event will be traveling for an exhibit in Geneva in June as a way to boost this ongoing impact. So I want to thank Isabelle and the WHO for working on this fantastic event with us. And I hope this event continues to impact more and more members of the cleft community worldwide, as it has done so far in Peru and Mexico. Thank you.
I think what Andrea just mentioned is like the conclusion of everything. We want our patients to find themselves through different activities, and we want to encourage families to support these activities. And that's what we saw in these Art Impact for Health. We see a change within the families, we see a change within the patients. And the strongest part is that these activities can be taken into their homes. They can keep doing art. And like I mentioned before, there's no right way or a specific way of doing art. Art is just letting your creativity flow. And that's why it's an individual activity, a family activity, a team activity. And that's why giving them this opportunity to talk about their feelings, to express their thoughts and share all kinds of experiences together is what brings resilience and takes such a powerful intervention with art and psychosocial. And integrating psychosocial support with art provides that opportunity to have an impact on the family and on the patient. We try to, from a psychological point of view, impact their social emotional development, improving their behaviors, helping, sharing, emphasizing, caring about others, and also have a control on their emotional aspects, since we know that cleft patients can be a target for low self-esteem, bullying, less confident, and lower social skills. We want to encourage everyone to think about how they can integrate art and psychosocial interventions to their programs, to the activities, because psychosocial support is as important as any other intervention or any other procedure that is done in cleft. It helps families, patients, and medical workers and professionals work together as one same goal. And I think that's kind of the takeaway about how we can integrate art into psychosocial support. Another important thing that is different from Mexico and Peru is that Colombia was done virtually. The pandemic was something that nobody was expecting, and it challenged all of our medical interventions, but we still found a way to help families and patients come together. And with Isabelle, all the way across the world, we sat down in a big park through Zoom, and everybody was doing art, and everybody was feeling together, and everybody's feeling supported through this activity. And I think that, like I mentioned, art has no limits, and it doesn't have to be in a specific matter to be able to impact our patient's life. And during 2020, we did our event in Colombia, and I think everybody was just very excited to be able to have something different in their interventions. Adding to our different situations, we always keep in mind that through art, we do heal, and that's what makes it so powerful. And therefore, we're able to show all these results worldwide. In engaging our stakeholders through different art programs, we want to bring awareness and shed some light on the different and innovative programs that we offer in cleft treatment. We want to include the government, medical communities, cleft families, other cleft teams that are in different parts of the country, and local shops and artists to participate in order to continue to our cultural background, which is what makes this so important also, like we mentioned. If it was just one same theme, it wouldn't be as powerful. We go into the country's culture, we want them to feel like they're part of their lives and we're part of their lives. So it's important to really understand what they need and what they like. And working and coming together as a community has multiple benefits, but overall, I think it just provides a sense of security to our families and patients in knowing that there's no limits with being born with cleft or having a child with cleft. There's no reason for them to miss out or feel excluded from any type of activity or any type of movement that they want to be involved. Building resilience from a national level involves creating better treatment opportunity, better resources and support throughout their lives. And at an individual level, we want patients and families to feel confident and strong without any social stigma, and offering them opportunities like art to find different abilities that they didn't know they had. And on a family and a community level, well, our hope is that they feel supported and engaged so that they can continue to offer their child a well-being. And that's kind of like our hope for these art for health activities. And we encourage everyone to reach out to us or reach out to Isabelle and Dianne and Grace for knowing how to include them in your programs.
Great, thank you. And before I close, I just want to give a big thank you to Isabelle, Camila, Dianne, and Andrea for joining us. This partnership with the World Health Organization has really helped Smile Train develop our organizational goals around psychosocial support programs like this. And we're able to see the impact and understand the importance of these joint events. I think that's it. I'll pass it over to you.
Thanks, Grace. And thank you to Isabelle and the Smile Train team. We can see through the chat that there's already been some folks inspired along the way. As usual, we want to spend about 20 minutes just discussing a little bit more about the project itself, about this idea of using art making as a psychosocial support, and even about the partnership between WHO and Smile Train. So if you do have questions, feel free to put your hand up, or you can type it in the chat and I'll read it out. But we'll give you a second just to think about what would you like to know more about, and who would you like to ask a question of, as we try to take this a little bit deeper from the Smile Train and what WHO experienced to thinking about also in our regions. What else could we be using? How does this start sparking our own creativity about engaging children and families with cleft lip and palate? Suraj, please kick us off from Chennai.
Hey, thanks. I'm just outside. I'm yet to reach my place. So, I was wondering, this art form varies across regions, different places, form different art forms. The reason why I'm asking that is I come from south of India, where folk, dance, music is something which is very commonly practiced. And even in villages, many of the community messages are passed through this folk dance and folk music and all of that. I have heard about this work, but this is an eye opener for me. So is there something which the experts can share how to make it local. They are talking, is there something which they can help us with?
Thanks, Suraj. I'm not sure who from the presenting crew would like to jump in on Suraj's question.
I would like to tell Suraj that I remember talking to the Mexican team about putting together this event, which Andrea, congratulations, and Isabel, congratulations. It was a beautiful event, and the choice of doing the how do you say that? La calavera, ¿cómo es que se dice? The skull, to using that. The skull to using that. I remember we discussed this because each of in our countries, we have different symbols that can really identify all within our community. So maybe the choice of the Mexican team to use the skull was, I remember discussing this with you guys, and this it's a hit, to see it, you see Mexico, and really identifies definitely Mexico. So maybe Suraj, something to invite some of your artists, local artists, to help you put together what will be the symbol. Instead of doing a mask or a skull, what would be something that within your community all of you can identify, and gather artists to decide what would that be. And I think that will help also all the community, because it's not only the patients, the families, the providers, to identify as doing that. I remember in Peru, we also, I don't know if you remember, Isabel, the little, we call it toritos de pucaraca, like a little bulls. Remember the children also painting those, and I guess that we gave you one as a souvenir from Peru. So that's something Peruvian that help us identify. We did the mask, and then the torito de pucaraca, we call it. So that will be something, a good idea to start the brainstorming process to do an event like this.
Thanks, Dianne. Isabelle, yes?
Yes, and it's to share with Suraj. In fact, you have no limitation in the type of art you will use, in fact, for this activity. That is very important. For example, I know very well your country, and specifically south of India, I have been. And for example, you can really combine, for example, your traditional music, traditional instruments, and as well, I will say, even more like your vibration, because each country has their own vibration in some way. And as well, you can combine with dance, but as well, we will do that, for example, in Morocco soon in September, to include as well theater. It's a mix of different type of art. And I know sometimes, the way art have been performed, and you can see sometimes in the museum, it's not, a mix of all different artistic expression. You have, for example, only an exhibit about painting, about sculpture, but the idea, it is really to change that and to demonstrate, in fact, all artistic expression is so profound, and specifically it is a way as well to realize humanity have the same wish, globally. For example, we wish all of us to have a world with more harmony, with more beauty, with more peace, And I think if we unify, the best of each culture in the world, we can really converge, in fact, the best of what we have learned, as I will say, country-specific settings, but as well as humanity. And art is extraordinary because it is a way to combine individual, awakening, evolution, and without any judgment. And that is so important. What it is beautiful, it is to celebrate the pathway, in fact, of each individual, of each organization, of each collective, and to say, what you have been able to accomplish, is extraordinary, and you need to be really proud of what you have done, and really it's just the beginning. It's just the beginning of new extraordinary adventure. And when you can share just your story, you can share your own, extraordinary, finally, pathway, because you change your, your eyes on yourself, and you are able really to say, okay, I am able to share it, just that. And of course, art is very extraordinary for that, because it is soft way, you know, to express yourself, you know, without judgment. Donc for example, we have demonstrated with what you have discovered, it is applicable for each culture, each country, and it is really to value, you know, the uniqueness of your culture, you know, in this unity, you know, because at the end of the day, we have, I will say, universal value, you know, and why we don't focus our attention on universal value and not just specific value, you know, or difference between countries, but how we converge, you know, together. And it is convergence of all individuals, you know, but as well of all the organizations, because as you know, many organizations, they are still, you know, in silos. They just want, you know, to do their own work or to promote their own things. But how we really connect, you know, the different organizations in the world, you know, and we make the difference together. That it's my message.
Thank you, Isabelle.
I would like to add just something real quick.
Camilla.
Isabelle said that it's so powerful because it's not just a one-time activity. We encourage families to go home and keep doing these experiences and be able to, you know, spread awareness about art. And that's why, and it's unique. There's no right way, or if you do it, it's just creativity. And we want children to express themselves, and we want families to also see that their children have different abilities that they didn't know. And we want them to not set limits on their capacity. So I think it's important that it's not just one-time activity. It's not just one-time thing that they can't do anything else. So we want to encourage everyone and their families to keep doing art, to find different kinds of arts that they like.
And thank you, Camila and Isabelle. That was also in the chat. You'll see from Bolivia, a resonance with the idea. It doesn't have to be visual art. I think Dianne and Isabelle were also mentioning, you know, dance, other kinds of artistic expression can be incorporated into this kind of approach, which is important. Nan from Ontario points out just, you know, the magic, I guess, in some senses in the Peru project, you know, tying it back, as Dianne was talking about, to an experience centuries ago of how cleft lip and palate people affected with cleft lip and palate were valued. I noticed also in Mexico, you know, this idea of the individuality of the people's face in the skulls that are decorated, and also obviously the individuality of people who are affected by cleft lip and palate. These are some really interesting ways, as you've pushed us to think about what in the cultures that we're working in can really be that extra tie-in. So we have all the advantages of art, but how can you find those things that really root it within a particular culture in place that allows to reinforce that overall message of inclusion and individuality and the ability to contribute to society? Now, Niti's been pushing us a little bit. Some of us have been journeying a little bit in a journal reading club and thinking a little bit about assessment and how even a patient's experience or a child's experience of assessing the surgery, that really stood out to me, you know, through the drawing and everything else, figuring out, you know, what was your experience of having a cleft surgery like? So Niti, do you want to ask your question about a little bit about the survey instruments? We heard that from Camila, I think, and also from Anaya, the idea of how we're assessing this. You know, it's great to talk about it, but what kind of evidence are we generating that these kinds of impacts really can lead to a better experience for cleft lip and palate patients?
Yes, Diane, as you mentioned that there were some surveys done and possibly some other instruments, it would be interesting, I think, to know for the patients themselves, the patients with cleft, what was it that they felt was most impactful, or, you know, what really worked according to you all?
Thanks, Niti. I'm not sure who would like to jump in. What did you learn from the surveys? Andrea?
Yeah, I would like to talk a bit about that. There was a question also in the chat. Someone was asking, are these programs permanent? And I think that's very important. Just for one event, you cannot really have like a huge impact. I mean, it's a huge impact because it's a trigger for other stuff. But after one session, the patients maybe had a good experience. Maybe they are interested in art and they want to engage in more of this, but then you want to see this continuing and happening in a continued matter. I mean, you need the patients to have more workshops, more opportunities to continue exploring their their expression, their creativity, their processes. So these kind of events have to be a trigger for that to happen. This is like an inspiring moment for them, an inspiring moment for our partners, an inspiring moment for all the stakeholders involved. And after that, it is important that you continue to encourage them to create these workshops, like Contigo Sonreímos, our partner in Mexico. They started doing these workshops like every once in a month, I think, to continue providing the patients with these opportunities, because creativity is something that you have to work as well as like you exercise. You know, you have to work on that. You have to improve your widen your options of how to intervene something, or what to do with art. And I'm only talking about visual arts right now, but this is like exponential when you talk about theater or dance or music. So it is very important that this is a trigger and not an only once experience.
And to add to your comment, Andrea, exactly. And we all know that, of course, to include art, I'm a psychologist myself, it helps in the healing process. However, when having an Art for Impact event like this, since we engage many people in our communities, policymakers, authorities, patients, families. So as I mentioned in our chat, this is a great incubator to promote awareness and change in the cleft realm, in the cleft community as well. For example, in my experience in Peru, thank God, Dr. Antonio Segarra, who is also an artist, I first met him and when I went into their clinic, he had done a Marilyn Monroe with cleft. So I was impressed to see that. And it was because someone had told them when they had a flyer promoting an event in which they're going to have surgeries, that why is it that you put that picture? It looks too ugly, and it kind of like affects people's sensitivity. So it made him think, what if a symbol of beauty, which is Marilyn Monroe, we cannot deny that, would have cleft. So to see that picture that he had put together, it was amazing, you know. And he, for example, since he's a very well-known artist, he invited, we first did 20 masks with cleft, and he gave away to 20 artists in Peru for them to intervene. Many people were not even aware of what was this, you know, and they donated their work. And that's how we had, like you guys in Mexico, we had an art exhibit in which all these masks had been intervened by artists. So that helped promote the awareness and engage different artists in the community. So I guess this is a great incubator for that, you know?
And I think another important thing from a psychosocial standpoint, with these activities, we do like a pre-test, post-test, a pre-test sort of asking our participants what they think they're going to get out of, what they're excited about, what they think about art. And then the post-test is more about how they felt during the activity. And like Andrea said, it's just a one-time thing. We can't say that it has a huge impact on their life. The idea is sort of get a feeling of how they felt. But another thing is, we know cleft patients, their treatment is for many, many years, and we want to offer them different spaces and situations and opportunity to be able to get a sense of belonging with their medical professionals, with other families, with other kids that go through the same thing, to get that sense of belonging and to know that they're not alone in this process. So it's important to show them that there's a different side of cleft treatment, not just going for interventions or going to the institution getting medical procedures done, but there's another side of maybe more human side of getting to know other patients and families and their medical professionals on a closer note. So I think that's important from a psychosocial standpoint, to be able to like grab their whole community, their whole like life structure, and show them that there's more than just getting treatments.
Thanks,
and that's what we try to do with the tests and the surveys.
Great, fantastic. We only have a minute left, but I think one other element of this that's quite interesting is the idea of the partnership between a cleft NGO and the WHO. And I know sometimes we feel like cleft lip and palate is seen as a niche, you know, as a non-communicable disease. Just very briefly, can someone comment on just what that was like of having, you know, the the umbrella of the WHO be part of this initiative along with the CLEFT organization?
I can start off, and then maybe Dianne or Andrea, if you want to jump in.
We really just have like 1 or 2 minutes,
yeah.
so just super quick, but I think that's important to touch on. It's a very important part of this endeavor, I think.
Yeah, well, I think that it's definitely helped us raise awareness in a different way, and having, you know, of course, Isabelle is wonderful, and having her join these events has really had a huge impact on our reach. And so, yeah, I think. Dianne, you just unmuted. I don't know if you want to add anything quickly.
Well, having a press release saying the WHO and Smile Train, of course, assures that many people more will participate. You know, policymakers, health authorities, of course, when they see WHO, they will come to the event, you know, so that helps.
That's very important.
And you know, it's for us, it's from WHO perspective, it's very important because, you know, it's as well to inspire, you know, other, of course, healthcare services, you know, health professionals, you know, and so on. And to say, you know, just with creativity, imagination, and the fact you can think a little bit out of the box, you know, you can make the difference, you know. Look, it's for us, it's absolutely critical, and it is extraordinary to have Smile Train as a champion, you know, to really spark how it is possible, you know, because the partnership is only successful because both are together again. That cannot be done just by WHO, you know, or Smile Train, but it is the way we combine, you know, again, you know, the beauty of country level, you know, how we value, in fact, and respect all people at country level and give a real voice to international level. And it is really what we want to showcase as well with international exhibit. It is not about just the expert over the world, but it is up to everyone, to every people, you know, to make the difference and to be the change, you know, and that it's totally another discourse, you know, in the global community, because, you know, before it's very top down, you know, you have, you know, only the expert have maybe 5 PhD, you know what I mean, and so on. But it's not about that. You know, life is about experience, is about sharing, it's about humanity. And we really believe in that. And we want to inspire change for, you know, better consideration for the voice of everyone, you know, and including the most, I will say, vulnerable people.
Excellent. Thank you, Isabelle. And I think, yeah, that idea of thinking big in terms of these kinds of partnerships and the work that's entailed really is an inspiration, you know, thinking about how we can be inspired by a variety of different stakeholders and working together. So well done for this. I think the quick takeaway as you leave today and think about your colleagues, I saw a lot in the chat, many people thinking of new ideas, how they could engage. And I guess my challenge would also be in every discipline. I mean, this was designed specifically as a psychosocial support activity. But if you're a surgeon, if you're a speech therapist, if you're an orthodontist, how could art making, how could some of the ideas that were surfaced today about engaging with culture be an asset to the kind of work and impact you're seeking and to the team's goals overall? So I think not too much time to unpack that, but a huge thank you to our presenters for putting the time in today. As we saw from the chat, I think a lot of people are thinking in new ways about how we can incorporate some of the learning that Smile Train and the WHO have had through this experience into our own context. And we'll look forward to seeing you again the next time. So thank you for joining us today, this morning, this afternoon, or this evening. If you do want to get in touch, you can check us out at Cleft Circle or info@cleftcircle.org. We'll also be posting the video and where you can also find some more information. I saw in the chat people posting saying, please do get in touch if you want to know more about this initiative and how to sustain some of the learning into the long haul. So again, thanks everyone today. Thanks for joining us, and we'll look forward to seeing you next time. Bye-bye.